All right, and we're live.
Fantastic. Awesome. Good evening, everyone. I'm Sennett. My pronouns are he, him, his, and I am a proud member of North Shore's Pride Board and the moderator for tonight's event, It's Okay to Not Be Okay, Getting to a Healthier Place for Our LGBTQ plus community. Thank you all so much for joining us tonight, members of the LGBTQ plus community and our allies alike. North Shore Pride's mission is education and advocacy for and about the LGBTQ plus community on the North Shore. And this panel tonight is a part of a series of educational forums that we've been hosting virtually due to the pandemic. Health is a very important and relevant topic at the moment. And tonight we wanted to invite some fantastic guests to talk about the different facets of health, from physical to sexual to mental and spiritual. It's not often that we have the opportunity to speak about health in an LGBTQ plus centered way. So it's important to have these educational conversations and create space to talk about health topics that may impact our community disproportionately. Before we get started, I'd just like to remind everyone, this panel is a part of North Shore Pride's educational mission, and any health concerns that you may personally have, you should always go talk with your doctor. I want to give a huge thank you to both of our sponsors tonight, Dr. Helena A. Santos-Martin, a board-certified specialist of internal medicine, who's just opened a new practice in Beverly and is fluent in English, Portuguese, and Spanish. And I'd also like to thank Rosaline Doherty, the CEO and co-owner for Right at Home Healthcare, which provides home care for seniors and disabled adults in locations throughout the North Shore with dedicated professional teams and caregivers to help improve the quality of life of your loved ones. Without your generous sponsorship, we wouldn't be able to do stuff like this. So thank you so much from the bottom of our hearts. I also want to say a huge thank you to our interpreters, Gabe Boynton and Kinsey Williamson, who will be joining us later tonight. We're always so grateful to have partners interpreting services with us. I'd also like to thank Joey Phoenix and Michelle Garcia from Creative Collective for helping on all the technical fronts of this and making all of this possible. We absolutely couldn't do it without them. So now I'm absolutely honored to introduce you to all of our guests on the panel tonight. So when I introduce you, if you could just give a little wave, that would be fantastic. So first of all, we've got Dr. Karen Vautour, who has been a clinical and administrative social worker for 35 years, specializing in geriatrics and personality disorders. She is currently the clinical director at North Shore Counseling Center in Beverly, Mass. Prior to that appointment, she designed and implemented the pre-admission screening / annual resident review process for the state of Massachusetts. Her work has included continuous work with clients, supervision, program development, policy, and grant writing. Thank you so much, Dr. Karen Vautour.
You're welcome.
Next
Happy to be here.
I'm so glad to have you here. Next, we've got Constantino Coco Alinsug, who devotes himself to social justice, culture and arts, LGBT youth issues and advocacy, HIV/AIDS research, and receives recognition both nationally and internationally for his relentless work. Currently the co-chair of Lynn Cultural Council, board member of Lynn Community Association, Inc., and board member of Lynn Community Television, a member of Boston Public Schools, Global HIV Clinical Trials Advisory Board, and the senior outreach manager of Fenway Health, AIDS Action, and the Sidney Borum Junior Health Center. Thank you so much, Coco, for being here tonight. Next,
thank you.
Thank you. Next, we got Reverend Joan Amaral, founder and guiding teacher of the Zen Center North Shore. Reverend Myozen Joan Amaral is a Dharma lineage holder in the Soto Zen tradition as passed down through Shunryu Suzuki Roshi and San Francisco Zen Center. Since establishing the Zen Center in 2012, she has been exploring the connection between Zen, social justice, self-care, and creativity as a path of true happiness and mutual awakening. Thank you so much, Joan Amaral. Next, we have Adrian Shanker, who is an editor of Bodies and Barriers, Queer Activist on Health, and executive director of Bradbury-Sullivan LGBT Community Center in Allentown, Pennsylvania. A specialist in LGBT health policy, he developed leading-edge health promotion campaigns to advance health equity through behavioral, clinical, and policy changes. Adrian administered data collection for the 2015, 2018, and 2020 Pennsylvania LGBT Health Needs Assessments. Adrian serves as a commissioner and health committee co-chair on the Pennsylvania Commission on LGBTQ Affairs. Thank you so much, Adrian. And last, but of course not least, we've got Fonda Feeling, who is a Boston-based performer in burlesque, circus, and fetish arts, as well as a sex and pleasure educator. They currently work as a full-time sex educator at Good Vibrations, and in the past have worked for local companies and independently as a sex and pleasure educator. As a non-binary, queer, disabled sex worker, one of their prime goals going into sex education was understanding and communicating the importance of intersectionality and inclusion in sexual and pleasure health. A current student at Boston University in human physiology, this anatomy nerd is excited to continue their work in education in more diverse venues. Awesome. Thank you so much, everyone, for being here tonight. So I'm just going to launch right into the first topic. We're going to start with talking about some physical health items, and I'd like to direct this first question over to Coco. So the first thing that we'd like to ask are, what are some of the, if you could speak to some of the primary medical inquiries that are specific to the LGBTQ plus community?
Thank you. I'm really honored to be here, knowing that I'm from Lynn and been the executive director of NAGLY for 10 years. So Salem is like my second home, and been invited with North Shore Pride. So working with Fenway Health, which is, some people might not know this, but Fenway Health is the world's largest and biggest LGBT health organization. And we're not only involved in Boston and Massachusetts, but we're also involved in a lot of clinical trials as well for the LGBT community, looking for a cure for HIV, doing HIV vaccine, and now with COVID-19, we're also involved with that. So when you go to Fenway, Fenway Community Health Center, that's the word community, we're also like a community health center like any in other cities and towns. So when you go to Fenway, we have our primary care providers, we have our general women's health or family medicine, we have our outreach educators who will talk about HIV and STI, health, transgender health as well. We also have like probably, as my last counting, probably have like 200 Fenway babies, because if you want to have your baby, you go to Fenway. So every year, so when we were founded in 1971, our services just gets bigger and bigger and bigger. And so when I still remember, I still meet some of the early patients of Fenway when they say they remember the first time they've been to Fenway, the only money they have to pay is 25 cents. And so, I just want everybody to know that when you go, you don't even have to pay. So we have a lot of services that could provide with that.
Awesome, great. Thank you so much. Fenway Health does some amazing work. So I was just curious if maybe you could speak to some of the main medical inquiries that you see in your job at Fenway Health specific to the LGBTQ plus community.
Yeah, I'm Fenway's outreach manager. So we not only work with direct patients care, but we also work with community organizations. So when we go out to the community, we also been asked with people about different things, from medical even to behavioral health. And it is our role and to connect them with services from Fenway. We also have the Sidney Borum Junior Health Center. Again, a lot of people don't know this. It's a community health center, but it's the only community health center in the whole New England that caters from youth from 12 years old to 29. So if some of the youth patients who are very uncomfortable going to a mainstream health center, for example, if they are uncomfortable, they can go to Sidney Borum Health Center, because it's guaranteed that all patients there are between that age bracket. And all of our providers are all trained with that age bracket as well. So again, there's always a place and space for all the services at Fenway. All you have to do is just let us know and we will provide that. We also have several branches, not only in Boston, but surprisingly, we have an office here in Lynn, and we can talk more about that later as well.
Awesome, thank you. And you mentioned also talking about that 25-cent thing and about how Fenway kind of is helpful for people who maybe don't have the finances. And maybe Adrian Shanker can speak to this as well. But one of our questions we have tonight is, can you visit a health provider without insurance? And what does that look like for people? And either of you can jump in on that.
Can I just say something about the previous question? So, I don't work at I'm not a healthcare provider. So I would certainly defer to Coco about the health insurance piece. But in terms of the health challenges that are pervasively experienced by LGBTQ people, the answer is all of them. So oftentimes we have, this false narrative that says LGBTQ people experience health challenges when it comes to, HIV or sexual health, and that the rest of our bodies are somehow, devoid from disparities. But the truth is that if you're an LGBTQ person and you have skin, then you experience challenges when it comes to dermatology. And if you have a heart, then there's there's issues related to our whole bodies, our whole lives. And one of the problems is that most federal data doesn't collect data on LGBT health, but the data we do have says that LGBTQ plus people experience health challenges throughout our lives in every health area. The leading cause of death for LGBTQ plus people in the United States is tobacco. Cancer is one of the biggest causes of death for LGBTQ plus people. We experience diabetes and obesity at disparate rates. There's significant issues with tobacco, alcohol, and other drugs. So in terms of substance use. So, we can't just think about LGBT health narrowly as an issue about sexual health. It is, and it's also everything else.
Yeah, I can talk a little bit about the insurance. Always remember, and I just make this very, very brief. When you go to any health centers or any hospitals and you have no insurance, look for a financial counselor, and that's their job is to facilitate and connect you with services. A lot of organizations have what we call sliding scale, so they will determine your ability to pay or ability of not to pay, and then that will be their responsibility. So always remember that if you need services, there's always the doors are always open. And I see Dr. Vautour also raise her hand.
I have a question for you, Coco. Could you say a little bit about the behavioral health and psychiatry available at Fenway?
Yeah, so I encourage everyone to go to fenwayhealth.org because we have a very big behavioral health department at Fenway and all of our satellite offices like Sidney Borum Health Center. And, a lot of services from drug addiction to HIV counseling to trans health programs. We also have a trans health programs that, if you want to transition and need guidance and assistance and help, you go to Fenway. We also partner with a lot of organizations outside of our state. And since we are a big organization that deals with LGBT health, we assist organizations outside of the state to give them the tool to provide service and care within their organizations and within their communities. So again, it will take me a lot of time just to talk about all the behavioral health programs at Fenway. Again, just go to fenwayhealth.org and just click the behavioral health and it will list everything there. And maybe I can talk more about later. I just don't want to monopolize this conversation.
Oh, no worries. We've got plenty of blocked off time for everybody. So you're kind of here for the physical health piece. I defer to you a lot here on this. And I believe that whoever is moderating our Facebook comments tonight will put in Fenway's website in the comments. So if you're watching on Facebook, you can probably just go to the link right from there.
Thank you very much. Yeah, that's really important. Thank you for doing that. But on top of the trans health program as well, a lot of people don't know this, but we have the psychotherapy and psychiatry and the therapy and support group. So that it's not only a one-on-one visit, but we have groups at Fenway, even from a problem with gambling. When you want to go, we also provide that service because we notice that there's a need for it, even within the LGBT community. And the most important thing, and it's also a big focus with Fenway, is our violence recovery program. As you notice, a lot of funding coming from the state have lessened, and a lot of programs, smaller programs within the state, and I know a lot of you are familiar that they've closed. So a lot of these, Fenway has to absorb a lot of the staff and a lot of the services provided by all these organizations. So we just opened like offices and satellite offices, like from the Cape to the middle part of the state, because when they say Fenway, it's always Boston, and I always reiterate this to people that it's not only Boston, but we care from all other states as well within the New England area.
Fantastic, thank you. In that kind of similar vein of talking about the different things that Fenway offers, speaking a little bit more generally, How do you know if you maybe aren't sure what kind of specialist you need to see, or how do you know what health provider is right for you? How do you navigate some of that?
So like what I said, first you go to Fenway, you set up an appointment, and we will assign a case manager who will triage you with any service you need.
Awesome. And I think I saw that Adrian maybe wanted to speak to something.
Yeah, I think it's important to remember that two things. So first, for those who are, lucky enough to live close to a place like Fenway Health, it's great to be able to access care from an LGBT health clinic. But LGBT care is primary care, and trans care is primary care. And we queer and trans people should have an expectation that care providers who provide care for humans will be able to provide, at the very least, culturally appropriate care and hopefully medically competent care, that people who live in more rural communities still should have an expectation of high quality care. And when providers say something, not a provider at an LGBT clinic like Fenway, but another provider, if a provider says, I'm sorry, I don't know how to provide something like hormone therapy for trans people, but they provide hormone therapy for cis people, they're really, that's intellectually dishonest. It's similar to someone who says, a provider that says, well, I know how to draw blood from men, but not from women. So we should have an expectation that our providers can provide at least the basic levels of care, that it should actually be an expectation. And that these geographic barriers to care are real, because the reality is that many queer people, many trans people in rural communities don't have access to wonderful healthcare options like Fenway or other similar options in other metro areas. But we still deserve to have the care that our bodies need.
I know Fonda is about to raise their hand, but Adrian, you nailed that one, because we always get calls from as far as Tennessee and Mississippi that they could not even provide a single brochure about safe sex because their state funding will not allow it. So Fenway has to get a certain grant of money for us to provide materials like that to help organizations who are serving the LGBTQ community. And we also have good relationship with a lot of organizations, well, most organizations. So we have that referral process.
And Fonda, if you had thoughts, please go ahead.
Yeah, I feel like we kind of went directly into what Fenway does from the original question, which was primary medical inquiries for the LGBT community. And I love Fenway. I think Fenway does amazing things, but not everybody has access to that. And not everybody has the luxury of being able to wait on the wait list for a PCP at Fenway, because you can't get other care there without that. So being able to ask the right questions to your clinician is very important for that. Adrian cut a lot of really great lines about the fact that all clinicians should be able to treat LGBT plus, no matter what. All clinicians should be able to do that without a problem. The fact is, we live in a world where that's not always reality, and people aren't always willing to do that. So it's really important to acknowledge the community aspect of community health, particularly in the queer communities. We have whisper networks. We have all of these amazing social connections that make it possible for us to get the social care as well as the health care that we need and we deserve. So being able to have those people who you can ask, there's gonna be a motorcycle going by in a second, I'm sorry. I will always tout online communities as a great resource. In the Boston, general greater Boston area, Queer Exchange Boston is an amazing group on Facebook that you can go on and ask questions like, hey, I can't access Fenway Health. Does anybody know of any doctors who have handled transitions in general in this neighborhood? And then being able to go to that first appointment and say directly, hey, this is what I'm dealing with. Do you have experience with that? And kind of just being able to say directly like yes or no questions. And that's hard for us as a whole. But I think it's an important tool that we can all get a little bit better with.
Absolutely. Thank you so much. That was, and I'm so grateful for, can you maybe repeat that organization one more time so I can make sure that in the Facebook chat, that's another thing we add as a resource?
Queer Exchange Boston is the group on Facebook, and many other metropolitan areas will have a Queer Exchange specific group.
Fantastic, thank you. And that leads into another question that we had under physical health, which relates to the idea of not every practitioner being necessarily LGBT plus friendly, or not having that be an explicit thing that's stated. How do people who maybe don't know whether or not it's going to be okay to come out either as gay, bi, queer, trans, out of anything under the umbrella, would you recommend people who either aren't sure if their doctor is going to take it okay, or have maybe experienced hostility on those fronts, how would you recommend them coming out, or maybe whether or not they even should come out to their practitioner, whoever they're seeing? And anyone can jump in. It looks like Adrian might jump in first on that.
I just want to say very quickly that it's very important to be out to providers, because without that, the provider really can't know how to provide the best care possible. I wish that there was a national stat on this, and unfortunately most states aren't collecting this data, but in Pennsylvania we've learned that 1/4 of the LGBT community is not out to all of their healthcare providers, a quarter of our population. And I would guess that it's the same in Massachusetts and frankly every other state. So without being out to our providers, the providers then don't know, well, what behavioral risks should they screen for, right? What preventative medicine can they recommend? So if a provider, doesn't feel comfortable or safe to be out to that person, if you're in a position to find a different provider that is safe, then it's worth changing healthcare providers to be able to be out to them. And if that's not a possibility, then consider bringing a friend with you to a medical appointment and being able to be your true authentic self in that appointment, and knowing that you have a safety net. But for example, a gynecology appointment, it's important that a gynecologist knows the type of risk factors related to gynecologic cancers when they're doing cancer screenings. It's very relevant, right? So for folks who are not in a position to come out, then there's sometimes there are other resources, including some online resources to get information. But for people who can, it really is very important to be out to your providers.
Awesome.
I would like to add what Adrian just said, which is very important as well, that not all providers knows about LGBT health. And so it's important for you to be really straightforward and honest to your providers, so that they can make referrals as well. That's why at Fenway, we provided a book for providers, which is called the Fenway's Guide to LGBT Health. I went to Seattle one time, and a friend of mine who also works at Fenway, was based in Seattle, told me, like, come with me, I have an appointment with my doctor. And we went to his doctor, and you could see the bookshelf, and he asked a very, very basic question about sexually transmitted diseases. And doctors, you can see the doctor grabbed that book from Fenway because he wants to solidify his information about STDs because of the question that my friend asked. So again, don't presume that all doctors know, and just they might make referrals for others as well.
Fonda, go ahead.
I want to take the opportunity right here to hold space for medical trauma, specifically around folks who are transitioning or who have been out to providers that have experienced backlash or violence from a provider. And hearing like you should be out to your provider, yes, that is accurate, that is true. But I want to be able to hold space for folks who that doesn't feel safe. Now, I love the idea of being able to bring somebody with you as a buffer. I think that's great. I hope that everyone out there who feels like they need that space can take it and have somebody just support them. I really want to acknowledge that if somebody's here listening to this and they feel afraid of telling their healthcare provider any aspect of their identity, that's very real, that's so valid. And I really genuinely hope that you have a good friend that you can say, hey, can you come with me? Or you have somebody, a family member, anybody that you can say, hey, can you come with me? I don't know if I can say the words out loud that I'm trans. I don't know if I can say the words out loud that I'm gay, but can you help me out with that? Can we make a plan? Can we write a script? So thank you.
Absolutely. Thank you so much for that acknowledgement. And I really hope that if there is someone out there listening who's in that kind of similar position, that they feel heard from that. They feel seen from that. And I absolutely agree. I think it's important what Adrian, what Fonda, what Coco brought up. If you can be out to your doctor, or whoever you're seeing, it's very important to be able to do that. If it feels unsafe, or if you've experienced hostility, trying to have that buffer, or trying and knowing that you're valid in yourself. And if it's possible for you, maybe finding another provider who works better for you, either in one of the resources that we mentioned or through word of mouth, talking to other people in your community, all wonderful things. Thank you all so much. And then to kind of cap off of this physical health section, before we move into some health policy topics, I would like to, Coco, you mentioned Fenway Health right now is dealing with COVID-19 stuff, is dealing with pandemic stuff. And again, anyone can jump in on this, and we'll talk more about COVID is related to mindfulness and spiritual health and also mental health in a little bit. But when it comes to physical health in the pandemic, what are some recommendations you have for people who are listening to navigate through this pandemic?
Me?
Yeah, if you'd like to go ahead first, and then anyone else can jump in.
Fenway Health has part of the Fenway Health organization is an organization called the Fenway Institute. They are the research wing of Fenway, and they are part of a lot of clinical trials, from HIV vaccine to HIV prevention to microbicide trials network. So a lot of our scientists and doctors are involved with research looking for a vaccine for HIV. Now, COVID came, all of our resources, all of our staff, by the mandate from NIH, is to put the HIV research on hold for now and focus all of our attention with COVID-19. And so part of that is, again, I don't want to market it, but it's always, we have all the list of COVID studies at Fenway. And we are looking for, you've probably heard it in the news, you heard there's studies looking for 30,000 people here and there. We're part of it. So we're getting more information as much as possible. We're also part of the COVID testing for the city of Boston and Everett. All of it are listed as well. Again, as any precaution, you need to follow the guidelines, and that's what's really important.
Awesome. So things like CDC guidelines, things that you can find on CDC websites, regular things like washing your hands, wearing your mask, physical distancing, staying home if you can. Those are just some of the ways you can kind of navigate health through this pandemic, correct? Yeah?
You need to be aware as well with guidelines within your city and your state, and you have to be aware of all of these guidelines, and yeah.
Awesome. Thank you. Great. So we're going to move on now to health policy. And I believe that, let me direct the first question over to Adrian. So our first question is, what is the status of health policy for the LGBTQ plus community in the United States? I know that's a super broad question, but maybe if you can speak a little bit to some of the things that you notice.
Well, that is a very broad question, because health policy, I mean, health is everything. Without our health, we don't have our lives. So, you know, health is transportation, health is education, health is all of it. But I think to answer quickly, let's look at a couple key areas. So first, healthcare, health insurance, access to care. So, you know, we have in this country a model of healthcare that's not healthcare, it's health sales. So it's framed around access based on economic considerations. And we already know that leaves an enormous amount of people behind. For LGBTQ plus people to access quality care, we have to separate money from care. Care has to just be available. Now, to be sure, the Affordable Care Act was essential in providing and expanding care for the LGBTQ plus population. It removed pre-existing condition discrimination for people living with HIV, for trans people. So it did a lot. Plus, it added healthcare discrimination protections, which, by the way, the Trump administration has already filed a final rule to remove, and my organization is one of the plaintiffs to protect the Obama era rule that protects queer and trans people from healthcare discrimination under the Affordable Care Act. But the Affordable Care Act doesn't go far enough. We really need a Medicare for all system in order to guarantee, not only affordable but affirming care. But that by itself doesn't fix the problem. There's also, issues with lack of training in health professions education around LGBT health issues. Most medical schools, most nursing schools, most social work schools don't provide enough time dedicated specifically to education about the clinical needs of the LGBTQ plus population. And then when we look at certain health disparity areas, there are specific policies. So for COVID-19, for example, we just won a statewide policy last week, a guidance that was published by our Secretary of Health about sexual health during COVID-19. New York City did this early in the epidemic. Some cities, some states have actually developed policies that have helped the community learn how to stay safe during COVID and also engage with our lives in the ways that seem meaningful to us. Stay home had its moment, but today, 6 months later, we can't expect people to abstain from their sexual lives for the next 2 years, right? So there's policies in every single area, whether we're talking about policies that, that make it easier for people to access care, or policies that specifically reduce or eliminate disparities. LGBT people have to care about our health policies. That includes clean indoor air laws in different states. It includes making sure that that states mandate training for certain types of care professionals. There's a whole bunch of different options. But what the last thing I just want to say is that LGBTQ people have a voice, and our voice can be heard loudly when we express it. So when we speak up and talk to policymakers from state legislatures to school boards, we can make sure that we help to advance LGBT health. And the most important things to fight for right now for LGBT health, in my opinion, are protecting protecting the Affordable Care Act, fighting for Medicare for all, and ensuring that that we vocalize the challenges with the Supreme Court nominee that would seriously take LGBT health back quite a few decades.
Amazing. You hit on pretty much all of the other points that we had in this topic. Amazing job. I'm wondering, so you mentioned some of these things about like what your organization does in kind of like these big issues and the things that we need to tackle. Maybe for our listeners, do you have any kind of like action items or things that we can do in our own community, just on the North Shore or in our own personal communities, to help with things like health policy and help, kind of challenge these things that the Trump administration is maybe leveling against the LGBT plus community and health policy?
I'll answer very quickly because I don't live in Massachusetts and I want to let other folks answer that question. But one, vote. A vote is one tool in our toolbox to express our opinions. It's only one tool, but it's an important tool. So we have an opportunity to utilize that tool in a couple of weeks. On a special day in November. And then there's also other tools. So another tool is to, write op-eds, and, whether you're most passionate about access to healthcare through, Medicare for all, or you're most passionate about, encouraging people to stay safe from COVID-19 by, wearing masks, op-eds are a great way to communicate that, and a really important thing to do. Plus, remember that policymakers that make policy on any issue make policy on LGBT health. School board members make policy on LGBT health when they decide if condoms are available in schools, when they decide what the sex ed curriculum looks like in schools. State legislatures make policy that impacts LGBT lives every day. So do members of Congress. Communicate to everybody about our health and our lives, because it's all intertwined.
And on the topic of voting, if you go onto North Shore Pride's website, northshorepride.org, we did just recently do another one of our last panel was about voting, about protest, about using your voice. So, and it was kind of Massachusetts, North Shore specific. So if you're maybe looking for some information on voting, that is a resource available to you, just to plug that for North Shore Pride real quick. Awesome. Thank you so much, Adrian. And then just one more, you touched on it already, but just to kind of capping off a lot of these sections, what are like some ways, like what are some things that we can do to kind of navigate health policy in this pandemic specifically? And maybe what are some things that like this pandemic has affected with health policy specifically? And of course, anyone can jump in on this if they'd like. We'll go with Adrian then.
I just wanted to give other people a chance to jump in first. So a couple of things. So first, please do listen to the experts and keep wearing masks. We know that masks work. The people that are saying that masks don't work, don't listen to them. Listen to the people that are the experts. This is a moment where we have to trust science and believe science, because it's not a moment to let the vocal minority of people that are saying that that science is irrelevant here. We can't let that win. Number two is advocate for sexual health policies during this virus. COVID-19 has unmasked the existing disparities that were already causing harm to LGBTQ plus people. And on top of that, while this virus is tremendously different from the early days of HIV in so many ways, and I'll explain that in 1 second. There's lessons learned from the brave and courageous activists who paved the way that we should remember those lessons. One of those most important lessons is that LGBTQ plus people always have to be our own healthcare advocates. Our population has to be our population's healthcare advocate. If the ACT UP activists waited for the government to act without them, we wouldn't have so much today. And by the way, here's how the virus today is different. And so these are just a couple examples. In the early days of HIV, President Reagan wouldn't say the word AIDS until after 5,000 people were dead. Here, President Trump, despite what he said during his press conferences, hosted daily press conferences talking about COVID-19 in the very beginning of the virus, even though it's arguable, and I would agree, that what he said was not particularly helpful. He named the virus, and he did talk about it. In the early days of HIV, pharmaceutical companies were slow to respond. Today, every pharmaceutical company was bidding on government contracts to create vaccines as quick as possible, and the FDA was talking about rushing through and expediting vaccines. I mean, we're talking about having vaccines sometime, well, the president says in 2 weeks, but the rest of the country saying in the next year or two. But we're 40 years into the HIV/AIDS crisis and there's no vaccine, right? So that's another tangible difference. And there are so many more. I mean, we talked about how in the early days of HIV, people who were dying were seen as, undesirables in communities, right? By the majority population. Today, it's seen as, it could be anyone. It could be our grandparents. It could be us, right? So there's a difference in terms of, it's not, these are people who did something wrong. It's like, this is anyone. It could affect any of us. And finally, like the one big difference, I think, is that the entire world shifted with COVID-19, whereas during the early days of HIV, people had blinders on and pretended not to see the people who were most affected. Healthcare professionals didn't want to provide service or care for people dying of HIV. Today, healthcare workers were heroes, at least in March. Maybe now they're back to being full-time staff in the eyes of our capitalist system, but healthcare workers were seen as heroes in March and April. And our states canceled closed schools, and the tax deadline was shifted, and literal mountains were moved. And in the early days of HIV, no mountains were moved. People affected the most were left behind. And so I do think this is a very different virus, a very different circumstance, and a very different politics. But LGBTQ people still need to be advocates, and part of that is fighting for sexual health information during this virus. And there's great resource through the New York City Department of Health. It's the best resource that's been published in the country on this. You can Google it. It's Sex During COVID-19, the New York City Department of Health. State of Pennsylvania has published similar ones, so has the City of Los Angeles and the State of Oregon. So there's other resources as well.
Awesome.
I just wanted to follow up a little bit on Adrian's notion of voting. Doing telehealth sessions with either medical people or behavioral health people is another way to vote also. Not only do you get the service, hopefully get the service that you need, but also it's telling these insurance companies and governmental insurance sponsored places like Medicare and Medicaid that this is important, that, you know, our health and our behavioral health, our mental health are important during this time, and we are willing to use technology, which may be second best sometimes, but we're willing to use it to get what we need.
Absolutely. Thank you, Dr. Vautour. I think that's something that I've noticed a lot in different things on Facebook and stuff as well. People talking about how things that we thought we could never do, people with disabilities were like, oh, can I work from home from these certain times? Can I do this? It was always, no, you can't. And then COVID hit and we realized, oh no, we do actually have the allowances for these things. We can do telehealth and it doesn't need to be gate kept and, you know, priced differently. So yeah, definitely encouraging using the services encourages insurance companies to continue to allow these things to happen. Am I right? Did I say that correctly?
Yes, absolutely.
Beautiful. Awesome. Thank you. Well, with that, Adrian, you had started to talk about things like sex during COVID-19. Could you list that resource one more time, just so I can make sure that also gets in the Facebook chat?
I'll put it in the chat here that can be posted there. But you know, I just want to challenge. So yes, fight for telehealth expansion to be continued, and also fight against the system that says that people can only access care if they have insurance that will pay for it. That, you know, many states that have allowed expanded telehealth have also had many problems because they put barriers up, like you can't get telehealth across county lines in some states right now. You know, those kinds of barriers are insurance barriers that are continuing to keep people from accessing care. And that's wrong. I mean, care is necessary, healthcare is necessary. The other thing to ask your state for, every state and every city health bureau, is to collect data on LGBT infection rates with COVID, hospitalization rates, and mortality rates. Only, I believe, 2 states right now, Pennsylvania and Illinois, are collecting COVID disparity data for infections, and I don't believe any state's currently collecting the mortality and hospitalization data. So this is something to also fight for.
Thank you.
Sid, I would like to add, yeah, we're in the middle of pushing for it in Massachusetts. It's really important as well to the listeners to really share their stories, because when we talk about policies, if you don't share your stories and don't talk to your elected officials, nothing will happen. So it's really important to know that they serve for us. You go to the State House, go to your city hall, and share your stories and ask people around if they're doing something for your story, which is vital for creating laws in the future.
Awesome. Thank you, Coco. And with that, I'd like to move on to sexual health and then later mental and spiritual health. So as Adrian mentioned, and he also just put in the chat to be shared in the Facebook chat, there's some talk about we, you know, can't expect people to abstain from their sex lives because of COVID for however many years it may take to get a vaccine, or however long it's going to take. And I was wondering, I'd like to let me start off the conversation. I'd like to start off the conversation about sexual health with maybe directing to Fonda Feeling to talk a little bit about what sexual health even is. I think that we tend to have a very strong lens on physical health, and people don't even know what sexual health means. So if maybe you'd be willing to talk to some of that.
Absolutely. So when folks think of sexual health, you kind of think about high school health class, right? So you're thinking about STIs, you're thinking about those symptoms, you're thinking of how not to get them, and you're thinking about how to not get pregnant. When folks say sexual health, that's generally where your mind automatically goes, because it's the first thing that you knew about sexual health. When in reality, it's this completely multifaceted, really complicated relationship that you have with yourself and with others. So sexual health encompasses your physical health, of course, but it also encompasses your emotional health, including your relationship with sex, your mental health, and your social health in a lot of ways, because, you know, sex with other people is a social interaction, generally. So it's this umbrella term more than anything else, because, you know, high school health can really only do so much. Hopefully that wraps it up.
Absolutely. Yeah. Thank you. I think that kind of just as a basic primer for people who are like, sexual health, what does that mean? And, you know, separating that from the kind of things we were taught in sex ed, especially because sex ed can be so limited to just like a specific type of person and specific type of relationship. So thank you for that. Awesome. Before we start talking about maybe similar things to what Adrian mentioned of sex in the age of COVID-19, I have a couple more things I'd like to talk about. So if you could speak a little bit to, similar with physical health, what are some of the unique sexual health questions or concerns specific to maybe our community?
Yeah, so queer communities have a lot. My dog just came running in immediately the second I started talking. Queer communities have a lot of very specific needs when it comes to sexual health that is often swept under the rug. And that can range from STI protection with different genital combinations than just biological heterosexual sex, to being able to navigate dysphoria and sexual interactions, so gender dysphoria. So I would say like some of the larger ones are, of course, STIs. Adrian spoke a lot about HIV in queer communities, and that will always be a little shadow that we have over our community. And we have a lot of resources that we didn't have 30 years before, and I'm really thankful that we have those. But there also comes into question things like being able to transfer STIs from like vulva to vulva, where many folks don't even consider that as a possibility, or being able to transfer from genitals to mouth. And so there's this lack of education on aspects of sexuality that aren't just heterosexual. And I think that that's something important that perhaps those details can be sorted out in a less PG-13 space at some point in the future. On top of that, I'm gonna go right into dysphoria. Gender dysphoria is so real. Defining it, it is when somebody looks at their body and they feel out of place because they don't feel like their gender is properly represented by what is in the mirror or being presented to other people. Now, a lot of that has to do with genitals and secondary sex characteristics like breasts, that sort of thing. And so when we're talking about sexuality, you're pretty much getting naked most of the time, which is exposing those parts of your body that might make you dysphoric. Or if somebody talks about those parts of your body a certain way, maybe that makes you dysphoric. And so there's navigating the dysphoria in sexuality. And honestly, that's something I could go on about for hours. But that is a very unique situation for the queer and trans communities. There are a lot of emotional and mental walls as well. I don't have the exact numbers in front of me, but we know that numbers for trauma and other symptoms associated with trauma are very high for many queer communities. And that makes navigating pleasure really, really challenging, and being able to communicate with your body and your partner in ways that feel good and safe. And by and large, you know, most of my clientele are queer, I'm queer. By and large, that's a huge aspect of dealing with our sexuality. Having a good relationship with pleasure, not always easy when you're used to either not feeling at home in your body or not feeling safe in general. And then always consent, always consent. I think that consent is not nearly emphasized enough in more traditional heterosexual sex health spaces, but particularly in queer communities, where sometimes the communication lines can be blurred in a lot of ways due to just different social interactions. If we're thinking from a pure like socialized aspect of we're used to being socialized for the heterosexual, like man to woman, and the communication standards just, they get kind of muddy sometimes. And so I think that consent in the queer community is its own unique I guess animal, its own unique like critter that we got to deal with. Does that kind of run it?
Absolutely. Yeah, no, that was very, very helpful. And thank you so much for I know that a lot of these are very broad topics, and there's things that like I would absolutely love in the future to be able to talk more in depth about. And that's one of the things that I was wondering if maybe we could like talk a little bit more about, but maybe not as in depth, but just some general talking about STIs and having different partners. We know that like, you know, I think in the past, we are getting better about recognizing that people either have casual sex or have multiple partners or different things like that, and are not limited to having sex with one person all of the time. Can you talk a little bit about just like some of the main ways that we can prevent STIs and be safe around STIs, and also be safe around having maybe multiple or new partners?
Yeah, so communication is key for all of this. Communication and being able to create a space where you and your partner or partners can feel comfortable either disclosing a status or having a frank conversation about what that looks like for them. And sometimes communication is scary, and that's okay if it's scary. But the first step really is talking about it and demystifying what's going on. And once you've hit that communication, and it could be something as in-depth as you've been dating somebody and you have a deep conversation about it, or say you just met somebody and you're having that conversation in between heated exchanges as the deed goes down. There are ways to navigate that conversation no matter when it happens, but it should happen. The number one way of preventing STIs, any high school health educator will tell you, it's by not having sex. But we all know that that's not 100% a thing. Barriers are a very solid prevention. So that would be condoms, that would be dental dams, and dental dams are kind of hard to come by these days. I'll be honest, they are. However, if you ever want to learn how to make a dental dam out of a surgical glove or a condom, hit up your boy, because there are ways to do that. Barriers, huge aspect of it. Lubrication, actually. I am a huge proponent of lubrication, particularly when it comes to barriers, because of friction. Friction's going to break a barrier down. Right? Like if you're using a condom and there's too much friction, it's going to rip, it's going to tear, and that's going to create the exact thing that we were trying to stop by having a barrier in the way. So lubrication is a great way to prevent it. Lubrication also can mitigate some micro tears in the skin during intercourse or other sexual activities, which, you know, isn't going to be 100% against whatever we're trying to prevent, but anything that we can do to mitigate any damage on mucous membranes is going to be helpful for creating an environment where those things will be a little less likely to happen, and it'll also keep you feeling healthier and happier the next day, right? So the next day you're not sore, you don't see any blood later. So like I would say lubrication is in a top tier of protection as well.
Awesome. Thank you for those kind of like different ways. I think that maybe we don't talk, we very much, you mentioned it in sex ed, it's don't have sex. That you won't have babies, you won't get STIs if you just don't have sex. But I think we don't think as much about, even with dental dams, I know I've personally advocated in different like high schools and places I've been and health centers where they've had condoms and not had dental dams. So thank you so much for speaking to some of those. And I see Adrian's unmuted himself. Go ahead.
I just want to add really quickly, first off, what Fonda said is really important about all of that. But I want to add vaccines as an STI prevention method, and two in particular that I just want to name. So for anyone listening who is either themselves or a parent of somebody who is within the age group where the HPV vaccine is still recommended, especially if it's before sexual activity has started for that person, highly recommended to receive an HPV vaccine. HPV is the leading cause of both cervical and anal cancer, as well as some oral cancers. And there's a vaccine. and the vaccine didn't exist when some of us were younger. So it's important to get that. And also Hep A. So hepatitis A is on the rise in most states, and almost exclusively the rise is being seen in the queer population, especially queer men and trans women. Hep A is, and I'll keep it PG-13, I promise, but Hep A is spread through oral fecal contact. Oftentimes we hear about it in terms of like not washing hands in restaurants, and like also please wash your hands in restaurants. But that's not the only way that it's spread, and it's really important to recognize that for the queer population, Hep A is sexually transmitted, right? So it's important that for people who engage in oral fecal contact, or casually referred to as rimming, to consider talking to their doctor about getting a Hep A vaccine, or if they don't feel comfortable with their doctor, to talk to another health provider, like for example, a Planned Parenthood facility or a public health bureau, because Hep A vaccinations are really important. You have to have 2 different vaccines 6 months apart, but then you're protected. And so it's not about don't engage in the kind of sexuality that's important for your life. It's about that there's some vaccines that are available, and in some cases free, depending on where you get them from.
Fantastic. Thank you for mentioning that, Adrian. Always shout out to Planned Parenthood. I love Planned Parenthood. I think they're great. Awesome. Thank you so much. And Fonda, we might end up doubling back because, you know, sexual health and mental health are really so intertwined, as you mentioned. So you're always welcome to come into these next questions, but I want to make sure that mental and spiritual health get some time too. So let's launch into those. And I will start with Dr. Vautour, and then I'll direct some questions over at Reverend Joan Amaral. So to start off with, we're going to actually start with the COVID-19 kind of question. How do you recommend people maintaining good mental health during this pandemic? What are some ways that people can take care of themselves in this new unprecedented time?
Well, I think it's very similar to non-COVID time, although COVID has its problems with isolation. So, you know, maintaining good mental health means maintaining a good daily routine, you know, eating, sleeping, exercising, working, playing, having as much of a well-rounded life as you possibly can. If you have medications that you're taking for either physical or mental illnesses, then please remember to take those. Have a go-to list of self-soothing behaviors, because, you know, this stuff gets to us all. You know, the isolation, I want to go out and I can't go out, or whatever. We need to be able to help ourselves too, because we're not as in contact physically with other people as we are right now. Be in touch with family and friends as much as you can be physically, and also on whatever electronic media, whether it's phone calls or Snapchat or video, Zoom, and maybe take time to develop a good positive habit. So possibly if you want to stop smoking, start chewing gum. You know, this is a great time when you have a little extra time on your hands because you're sitting home alone or sitting home with a friend, to do something new, to get a habit in place, because it takes about 30 days to get a habit in place. So, you know, we've had what, 6, 7, 8 months now where we could have had really some good habits replacing bad ones. And finally, find a way to have some fun in your life. Whatever it is, you know, can you get out and hike? Can you get out and, we're close to the ocean, so can you get in the water? Can you swim? Can you boat? Can you bicycle? Can you, you know, play tennis, something, but anything, just get out and do something with people.
When I see Fonda's unmuted themselves, go ahead.
I want to add that, like, having a fun element without going into too much detail, masturbate.
Yeah.
Make yourself feel good in that way. Give yourself those endorphins. So many good hormones are released during orgasm, during play. And it's a great time to get to know yourself and your body. And it's a great time to get to know what you like, right? Because it's you, it's on your own. you get to explore. You don't need to worry about anybody else. So it has that like element of play that sometimes we don't get otherwise. So like, maybe you're like, oh, I have enough hobbies. Well, there's one more thing you can add.
It should be said out loud that masturbation does not spread COVID-19. So
That's true. Awesome. Thank you. Yeah, no, and definitely one thing, like I see a lot of people have been doing retail therapy during COVID. That maybe is one thing that you can look for as like a self-care item for yourself. So fantastic. And one thing that Dr. Vautour mentioned, setting these good habits for yourself, or maybe like picking up, setting a routine, self-soothing. One thing I maybe want to direct to Reverend Joan Amaral is talking about things like mindfulness and some of the things that you maybe do in your practice that people could maybe look into and the effects of that.
Thank you, Sid. Hi, everybody. I just want to say what a joy to be with you. I am learning so much and I'm having fun. And Sid, I'm really tempted. I don't know how this is going to go over, but since it's my time and it's after 8, I have my bell. It gets a little, yay, Coco. It gets a little distorted in Zoom, but I don't want to talk about meditation. I'd love to just do it just for a minute, because I'd like to show you, if you hear meditation and you go, ah, no, you know, that's not for me. That's for people who are enlightened or whatever, people who are calm. My mother said, Joan, you've been meditating how many years and you still get angry? Yes, I get angry mindfully. Anyway, so listen to this. And breathe. You're already breathing, but notice your breathing. And can you enjoy the fact of your breathing? On the inhale, can you expand into infinity? And on the exhale, can you just drop down, let go, as we say, or just simply ground? Know that you are taking your place on planet Earth. Occupy that place fully. But all we're doing really is just breathing and noticing we're breathing. And, you know, one of the things I feel sort of in COVID, but just as a human being, sometimes overwhelm, you know, sometimes just gripped with anxiety or panic or shame, grief. Take your pick, choose your favorite. And it's very helpful sometimes to just drop into the sensing body. I mean, I think dropping into the body, you know, trauma was a word that was used earlier, and I really respect that. For some of us, our bodies may not be safe. They may not feel safe. Yes, I love that, Fonda. Fonda just picked up her pooch. That's a perfect expression of where I'm going with this. The dropping into the sensing body, where you can feel that soft pooch feel. It's so comforting, the warmth of another being. You know, just in your room, right where you are. Or you can look at my stuff. I got lots of bling back here. I do this on purpose because it's helpful for me. These are so bright and cheerful, these sunflowers. They're seasonal. And then there's this, I did light my candle. I hope that wasn't too much, but you know, that warm, flickering, alive kind of eye object, you know, something for the eyes to land on or something to meet the eye organ. It's so comforting. And then I did light a stick of incense back there. You can't experience that. Unfortunately, we don't have Smell-a-Zoom, but you know, the scent, the smell, the sound of the bell, these sights. And then the feeling of your dog, or I have to admit, I have a fuzzy blanket. It's going to be hard when things aren't virtual anymore and I can't show up at something like this on a panel with my fuzzy blanket. But maybe I will, I don't know. So the skin making contact with wonderful textures. This is all so helpful for me personally, maybe for you, maybe you feel that. We call it opening the sense gates. And it's also called being present, being right here where there's no future, there's no past, there's just this blessed moment filled, Fonda, with all kinds of pleasure. Find it and enjoy it. So this is one expression of meditation. I forget what your question was, Sid, but this is one view. You know, as a Zen priest, I was trained as a dancer. And Fonda, I have to tell you, I hope this is not name dropping, and I don't know how she's going to feel about this, but my Dharma teacher, who was the abbess of San Francisco Zen Center, her daughter is a dear friend of mine, Nina Hartley. I know her as Mitzi Hartman. And I should have brought, I wish I had thought ahead of time to bring my mug up. My mug says Beacon of Sexual Literacy. But I feel totally underqualified. I'm not going to talk about any of that, except I'm a big supporter, because meditation for me is about, as someone said, who was it earlier? Adrian, it might have been you, dropping into your true authentic self. Please let us drop into our true authentic selves. There's an instrument that calls us to the Zendo when we're in physical space, the meditation space. It's called the Han, and you hit it, and it's like a wooden block that you hit, and it means come to the Zendo now, come sit, come wake up. And what's written on it is, great is the matter of birth and death. Life is fleeting, gone, gone. Awake, awake each one. Do not waste this life. And in Zen, we talk a lot about not wasting time. What is it to waste time? I think one way we waste time is by not making contact with our authentic self and allowing it to just shine.
Absolutely. Thank you so much for your.
Wow. I guess I'm making up for lost time.
Yeah, I don't want to interrupt. Thank you for the fun that we're having here with your little meditation. Fonda bringing their dog in. I love to see all these fun little things. I want to make sure that we thank you so much for talking about spiritual health and showing that mindfulness and meditation, they're not just for people, as you said, who feel calm all the time. That's not a thing that is necessarily applicable for people. So everybody feels different feelings all the time. So thank you, Joan, for your wisdom there. And Fonda, real quick, did you have a hand?
Yeah, I'm going to say it because I think advocating for ourselves is very important and it's a good example to set. Joan, my pronouns are they, them.
I'm very sorry. Thank you very much for the correction, Fonda.
Yeah, you're good. Thank you.
I wanted to give you a chance to advocate for yourself. I didn't want to step on your toes. So thank you, Fonda, setting that example. And thank you, Joan. Awesome. Great. Well, then we're going to move right back to some mental health stuff. I want to make sure Dr. Vautour also gets some more time before we wrap up. One of the questions that we really had a good time with or kind of talked about a lot when we were setting up this panel is the idea of a lot of people right now are finding themselves maybe in a mental health crisis or in like what we call maybe like a hot moment. What are some recommendations you have that for people who are maybe experiencing that or noticing that in themselves, or maybe even some warning signs of noticing that in themselves to put the brakes on?
Oh, let's see. People are having some difficult times now, particularly if you're a very social person and you're not used to being alone or sequestered with very few people during COVID. Some of the warning signs are if you have pretty radical changes in your moods, if your moods are way swinging more than they usually do, if your habits are more out of control, you're eating, you're drinking, you're gambling, you're sexual habits that are way beyond what they used to be because you're compensating for something, you know, the loneliness. And also thoughts of hurting yourself or hurting someone else or becoming very paranoid. You know, like COVID is going to kill everyone on the planet. It likely will not. But those are some of the warning signs. And if you're having those warning signs, please contact either emergency services or a mental health center. One tragedy of COVID is that some mental health centers are no longer accepting referrals. And therefore, places that are accepting referrals have very long waiting lists. But still, call, and if your issue is urgent, please say that, advocate for yourself. I'm feeling suicidal. I'm feeling very fearful of just getting out of my house, how things are happening. If you're able to think, if you're not too far out of whack and you're able to think about some things about putting on the brakes, know what you need to be healthy and follow your own advice. You know, if you know that you need to take a walk every morning, by gum, get out there and do it, you know, and help yourself. Have a go-to list of self-soothing activities because we're all gonna be upset or fearful or worried at times, and you can distract yourself. Distraction does work. You know, what's too dangerous for you? Is it watching too much news on TV? Is it binge eating? And try to find substitute behaviors for those. Have distractible activities, know what you want to do. Find your people, get support, talk to people, be with people as much as you can, but wear your mask and socially distance. You know, create a customized playlist. Lots of people are into music. Create customized playlists. Okay, I do this while I'm walking. Oh, okay, I do this while I'm waiting for the bus or whatever. And as I said before, replace a bad habit with a good habit. You want to quit smoking? Start chewing gum. You want to quit biting your nails? Learn to knit. You know, I mean, but think about some of those things that you can do to help yourself. They're really very simple. And, you know, we teach them as just part of therapy. You know, I generally teach people, I ask them always, so when you're upset, what are your go-tos? You know, are you paying attention to your senses? Do you know, do you want to hold something fuzzy? Do you want to take a shower? Do you want to hear beautiful music? And so that's sort of how I help people kind of move into a better headspace when it comes to mental health and in general and in dealing with COVID.
Thank you. Awesome. And Fonda and I just put in the chat a couple of little things that I will have somebody put into the Facebook chat. The crisis text line is really good. You can text home to 741-741. There are also different, if you Google, there are different kind of keys that you can text them that for like, I believe there's one for like substance abuse. There's one for specifically people of color as a resource. So that's a great one. The Trevor Project is wonderful. And the suicide prevention hotline recently, I believe, got signed into being able, you just dial 988.
It's coming, it's not here yet. It's coming.
Okay, it's coming. Awesome.
It's coming, yay!
Yay, awesome. And then just in the interest of time, I do have one more question. We're getting towards the end of the night. So before we wrap up, I have one more question for Dr. Vautour. So one thing that I think maybe some people are thinking about right now is it safe, if let's say somebody is in a heightened mental state or is in a crisis state right now and they are finding themselves, they're realizing, I think I need a higher level of care right now. Is it safe for people to get inpatient or maybe partial hospitalization care right now? And what maybe does that look like a little bit?
Yes, it is safe. There are kind of two ways to access higher levels of care. You can go to an emergency room. That is more risky these days, but generally speaking, the inpatient psychiatric units are very strict about their COVID protocols, masks, social distance, wash your hands, wear gloves, that type of thing. And if you're interested in getting into a hospital and not going through an ER, call an emergency service line, a psychiatric emergency service line. And partial hospitalization programs of many ilks for, just regular or eating disorders or substance abuse, they are still running on a virtual Zoom, sort of a Zoom platform also.
Fantastic. Thank you. Awesome. So now that we've got like 10, 12 minutes left, I just want to give everybody just like a minute or two. I might cut you off if it gets beyond that. I want to give everybody a chance to kind of give final thoughts or last things that they want to get out there. And we'll just go backwards from the way we started. So I'm going to start with Coco. If you could give us kind of your last little thoughts.
Yeah, I've been listening and posting links to some of the topics we've discussed. And I also noticed you've posted it in your Facebook page. I just would like to thank you, Sid. You're doing a phenomenal job and just amazing. And I know Hope has been texting me the whole time, and I told Hope, like, don't disturb me because I'm focusing with the live stream here. But I remember the time when we started North Shore Pride, Hope and the rest of the people, and it's really nice to be part of a North Shore Pride sponsored event and just being reconnected back with my Salem North Shore involvement. So thank you.
Thank you so much, Coco. So grateful to have you here tonight. Awesome. We'll move on to Adrian, if you could give your final thoughts.
Well, I have to just give a quick shameless plug again for my new book, Bodies and Barriers, Queer Activists on Health. When you write a book and it comes out at the beginning of a pandemic, it really screws up your book tour. So that's an opportunity to zoom into North Shore Pride today. But this book was about LGBTQ people telling our own stories about the healthcare experiences that we've had. So it's about all of us speaking up and saying, this is what happened to me. These are our stories. And I just want to encourage all of us should tell our stories. We should all share loud enough so that even our healthcare providers can hear us, because really that's how changes will be made. So Sid, you asked earlier, what can people do to improve LGBT health? One thing we can do is to also share our stories. When I was putting this book together, one thing that really struck me was I started telling my friends about it, and they kept saying, oh yeah, this happened to me. This traumatic thing happened to me. This not quite traumatic thing, but really bad thing happened to me at this doctor or that doctor. But you know what? Our doctors never hear that. Our doctors, they so frequently don't hear that. They don't hear that feedback. And when we speak up and when we advocate for ourselves to our healthcare professionals, to our policymakers, our stories actually have the power to make a difference.
Fantastic. Thank you so much, Adrian. And hopefully someone in the Facebook chat will also put Adrian's book. Thank you so much again. And now we'll move on to Fonda Feeling. Last thoughts.
All right. Pleasure is one of the more important things we can do for ourselves at this time. Being able to take pleasure in day-to-day things, if it's sitting and having your coffee, if it's just watching like the rain out the window, or if it's masturbating. And just being able to acknowledge where that pleasure comes from and how to best access that pleasure. And it's really hard right now. It's really hard when you have all of these looming, really, really anxiety-provoking things to be able to feel pleasure. But taking that time and really saying like, all right, here, I'm going to take a half an hour to just feel good is something that's important that we need to be able to at least strive for. Maybe it starts with 5 minutes. It's the same thing as meditation. You need to be able to build up to it sometimes. And taking the time to feel pleasure, to feel good is something that we all need in general, let alone right now. So that's kind of what I got. Pleasure, especially for queer folks, and being able to just revel in it is something that really is revolutionary, and it's something that can really be powerful.
Thank you so much, Fonda. We're so grateful to have you here tonight. Awesome, great. And speaking of meditation, why don't we move on to Joan Amaral? If I could get just like a minute or two, your last thoughts.
Well, thank you. Thank you so much for allowing me to be here with you tonight. You know, meditation, this word mindfulness, the Sanskrit word is sati. It just means naming, noticing. It doesn't mean calm. So if you're not feeling calm, it's okay. The most important thing is just telling the truth as to what's happening right now and owning it. And you're perfect just as you are. Thank you.
Thank you so much, Joan. That was beautiful. I love that. Awesome, great. And then last but not least, Dr. Karen Vautour, your last thoughts, please.
Well, thank you, Sid and Gabe and Kinsey, for all your work here tonight. Thank you, Hope Watt, for inviting me onto this panel. It's wonderful to be with a group of interesting and diverse people. And I would like to encourage people to continue to take care of their mental health because it's available to us all.
Fantastic. Thank you so much, Dr. Karen Vautour. Awesome. So I'm just going to launch into, thank you so much, everyone. Again, I can't express, from the bottom of my heart, it's so wonderful to be here with you all tonight and to be able to moderate this panel. This was so much fun and also so informative. I feel like I've really reaffirmed some things I already knew and learned a lot from all of you. So thank you again. I want to thank our interpreters from Partners Interpreting, Kinsey and Gabe. Thank you so much for being here. It's such an honor to have you all here. I'd also like to thank our sponsors again from the bottom of our hearts. We couldn't be able to pull all this stuff off if it weren't for the people who are funding us. So thank you again to Dr. Helena A. Santos-Martins and to Rosaline Doherty, the CEO and co-owner for Right at Home Healthcare. We appreciate you all so much. And then also, of course, to Joey Phoenix and Michelle Garcia from Creative Collective. We wouldn't be able to do the tech. They handle the tech stuff that we wouldn't be able to figure out on our own. So thank you everyone who's contributed tonight. I want to make sure everybody knows we will be having more of these panels. We won't be having it at a regular Thursday next month because the Thursday that we usually do these also coincides with Thanksgiving. So we actually will be having a double feature in December. So on December 3rd, we'll be having a disability awareness and the graphic will be posted on our Facebook and on our website, North Shore Pride. You can also find us on Facebook and Instagram, North Shore Pride. On December 3rd, we'll be having a disability awareness panel about advocacy and awareness for disabled people. And then we will be having an inspirational service on December 30th, just to kind of like inspire people, cheer people up in these times that we're all in. And you know, it's right around a lot of holiday season. So yeah, we'll be keep an eye out for our double feature in December. If you'd like more information about North Shore Pride, again, you can go to our website. We're on Facebook, we're on Instagram. We're also talking about health. We're working on an ever expanding resource list on our website. So we've got a tab that the wonderful Joey Phoenix is working on, especially that's got different community organizations, different health organizations, different social organizations that anybody listening tonight might find helpful or relevant. So we're working on that. It'll continue to grow. And we are also still planning North Shore Pride 2021, whatever that might end up looking like. Again, I'm Sid Sennett from North Shore Pride. It's been so wonderful moderating for you all tonight. One more round of thank you, Dr. Karen Vautour, Fonda Feeling, Reverend Joan Amaral, Adrian Shanker, Coco Alinsug. We got Kinsey, we've got Gabe from Partners Interpreting, and then our sponsors, which I'll run through one more time. I've got my big list on the side here. Dr. Helena A. Santos-Martins and Rosaline Doherty, the CEO and co-owner for Right at Home Healthcare. Thank you everyone who tuned in tonight to listen. We appreciate you all so much, and everyone be well.